Okay, so let's talk about Chapter 6. This will be I think, the last recording for Chapter 6. I just want to emphasize these issues around fire safety. And so, again, your role as a health aide or personal care or home health aide or personal care attendant is to report any kind of damage to equipment, space, heaters, any kind of flammable materials. We want to be really conscious of how we use oxygen if that's happening in the home. Any kind of frayed wires, and again, careless smoking. If you see, unfortunately, occasionally there'll be a client, maybe an elderly client with COPD or something who's on oxygen who will insist on smoking. And so that combination of having a cigarette and oxygen tanks or nasal cannula on the face, it's just a really bad combo. It's very hazardous. Anyway, you'll want to talk to the supervisor if you see any of those things or are concerned about any of those things. Again, make sure that the clothing you wear is not loose and that you're not likely to catch it on fire if you're working on a stove, something like that. Really discourage or absolutely prohibit smoking in bed. That's just really dangerous. You want to stay near the kitchen when you have things on. Don't leave when the dryer's on, and make sure space heaters are turned off if they don't need to be on. Again, lots of common sense stuff, but just things to be conscious of. We need to make sure that the smoking alarms are in good working order, and that homes have fire extinguishers, and you know how to use them and where they're located, and that they're not expired. So again, remember the word pass when you might have to use a fire extinguisher. Pull the pin, aim the spray at the fire at the base of the fire, and squeeze the handle, sweeping back and forth. Race is the other mnemonic to remember. Remove clients from danger, activate 911, contain the fire, extinguish or call the fire department. So the focus here is, get folks safe, and as soon as they're relatively safe, you want to call 911 as soon as possible if there is a fire. If you're working in an institution type setting, they'll often have regular fire drills where everybody will have a certain procedure that they have to go through. In the home, it would just be important to locate those fire extinguishers, know how to get people to safety, and then, of course, where the phones are so you can call 911. Let's see. Again, more details about what to do in case of fire. You can review those in your chapter. Many of us have heard them before. I want to talk a little more in this section about restraints. I think they're really important. So again, definitions. Restraints, a physical or a chemical way of restricting movement or behavior. And restraints are really kind of a last choice measure, but the goal is to try to keep someone safe. Suffocation, just for definition purposes, is death due to lack of oxygen. So let's talk about problems that restraints can cause. We have all kinds of restraints. We have wrist restraints, as an example, which can keep someone from being able to use their arms. We might have the restraint on the wrist, and then that's secured to some part of the bed. You might have a restraint like a jacket type item that limits their ability to get out of the chair or bed that they're sitting in. So lots of different kinds of restraints, and again, they are a last choice measure, and they require a medical order. So the physician has to write the order for the use of restraints, and there's a whole protocol that the nurse or the aide needs to follow on, securing the restraints, checking the restraints, that type of thing. People have been injured from restraints due to lack of circulation, lack of oxygen. So it's very important that we use them, as a last choice effort. They do require a medical order, and there's usually specific forms that have to be filled out, checking the client usually every 15 minutes, sometimes more frequently. So it depends on the protocol. We've seen other kinds of problems besides reduced blood circulation. we've seen stress on the heart, incontinence. Long-term restraint use can cause weakened muscles and bones, loss of bone mass, muscle atrophy, and of course pressure sores. If someone does have chronic restraints, we want to make sure to move them regularly. It could really be a setup for pressure sores, which can be deadly. There's lots of problems with restraints, so again, we want to avoid all of these issues, everything from suffocation to agitation, um, poor self-esteem, death, those types of things. So again, they need to have a doctor's order, and it's against the law to use them for convenience or as a form of discipline. So they're really, again, a last choice, the goal being to keep the patient safe from themselves. An example might be a patient who's demented, and sometimes they get this behavior where they're picking a lot, and they're picking at their skin, it's like a repetitive thing, and so sometimes to prevent them from injuring themselves, we might need to use restraints. But it's really a last choice. We really try to do everything else we can before we get to that point. We want to again, like what this is describing, alternatives. Try other things to reduce the need for a restraint. Sometimes we're having worked in the emergency department, there have been occasions where someone's really combative or agitated or totally out of control that we've had to use like a chemical, like a sedative, and some restraints to keep them from harming us or harming themselves. Again, we need a medical order for either of those things, and then with the restraint use, typically you need, at least in the hospital setting, 2 nurses to check off that things were happening appropriately. And often you need more than one person to help you if you need to get somebody into restraints, because they're usually not happy about it. So again, there's a list of restraint alternatives on page 73. Let me just flip to that and make sure there's things there. So, for example, they have a picture of a lap cushion, which can be used to keep someone in a wheelchair. Sometimes people are confused and they get up and wander off, and maybe we need to keep closer track of them. So those are alternatives to the more significant restraints. So good to review that. Take a look at that in your book. Again, there needs to be constant monitoring. We don't want somebody to get in a position where the strap is around their neck or cutting off circulation in their hands. So there needs to be an order to apply the restraint, and then there also needs to be a medical order to discontinue the restraint. So, and we also need to be offering the client the chance to go to the toilet. Of course, make sure that they're eating and taking fluids and that type of thing. Repositioning might be necessary to keep pressure off certain areas. So again, there's a whole protocol to restraint use, and I alert you to really focusing on that section in your book, because it is important. I am going to, I think, wrap this up. I was trying to recall if I was going to go over these. I think we're going to, let me pause for 1 sec. Okay, and so we are just going to wrap this up. There are some additional suggestions in the book that talk about if you have to use your car for your work, issues to think about there, and then also issues around if you're working in a high crime area, how to be safe, be aware of your surroundings. So I'll let you review those on your own. Again, send your instructor an email if you have any questions. But this wraps up chapter 6, and we will move on to the next chapter. Thanks for listening.